Migori County, a former part of Nyanza province in southwestern Kenya. Bordering Homa Bay County to the north, Kisii County to the northeast, Narok to the southeast, Tanzania to the southwest, and Lake Victoria to the west. The county also borders Uganda via Migingo Island in Lake Victoria. With its county headquarters in Migori Town, the population of Migori County as per the Kenyan National Census of 2019 indicates that Migori County population stands as 1.1 million people. Migori County, just like any other part of the country, has a youthful population with nearly 500,000, with 49% of the total population being below the age of 15 years and 25% being between 10 and 19 years. This youthful population can spur the development of the county, provided the right investments are made in the health sector.
Over a period of time, we've implemented the Participatory Advocacy Model for young people, the PAMY project supported by HIVO's Southern Africa office, and the project looked at how can young people be meaningfully involved in decision making at the county level.
At first, we were representative of the youths, but I felt that we were not meaningfully engaged. Like we were just there for rubber stamping. I can just say we were just there for rubber stamping because we were there, but we don't know what we can go and talk about them. We were being called in meetings involving the stakeholders and other county leads, but we could not speak out because we were not the capacity built on what to say. But right now, when we go to meetings, we know what to say because we have been capacity built on. We know the budget, we know the sexual reproductive health, the policies. You find that when we were there, we didn't even know what are the policies guiding sexual reproductive health. We were calling ourselves sexual reproductive champions, but we didn't know even the policies that guides the sexual reproductive health. We were just there. I think we were rubber stamp in general.
Under the PAMY project, basically I coordinate the advocacy activities in Migori County, trying to work with young people to empower them, to capacity build them, to provide them with technical assistance on issues to do with advocacy, budget analysis, how to engage at the community level, how to engage policymakers. I also work with the policymakers just to ensure that there are allocations for reproductive health, allocations for issues to do with sexual gender-based violence, and at the same time to ensure that policies are implemented in the county.
The high population can, however, also add pressure in the provision of services if relevant investments are not made. As it stands, increased rate of teenage pregnancies, increasing cases of new HIV infection, and gender-based violence among adolescents and youth in the county are some of the challenges that require more attention and increased investment.
As a county, we realized that we had many challenges. Teenage pregnancy, or which we call adolescent pregnancy, HIV/AIDS, sexual gender-based violence. And we also realized through them, the young people, is that their issues are not well known. So the advocacy model came quite in hand. And then the monitoring and evaluation, and then coordination and governance.
At that level of advocacy, I've been able to reach out a number of challenges to the technical working group, and I'm glad some of the challenges I've aired out have been solved at the level they can do it. And I'm glad that taking my contribution to the technical working groups as important.
The DRH 2013 report identified that young people and girls suffer from some of the worst sexual reproductive health rights outcomes in Kenya. And Migori County is no exception. The youth are vulnerable to sexual abuse and violence, STIs including HIV, unattended pregnancies, unsafe abortions, FGM, early and forced marriages, obstetric fistula, and maternal mortality.
The function of today is to launch a multi-sectoral action plan to improve the health and well-being of adolescents and youth, more so in Migori County, there is nothing that can be done without financial support. Is it true? So I'd rather urge the Department of Health, during the time that you will be, even the Department of Children and Education, during the time that you will be doing your budget for the next financial year, ensure that you put budgetary allocation so that we can actualize whatever is there in the budget.
So it has been good working with NAYA. We have a task force team which NAYA has been key from the development of the action plan to the launch to the implementation, which is still going on. So the county priority is to implement the recommendations that have been found in the midterm evaluation. The advocacy part still remains key. So as Power to Youth, together with the NAYA that is coming up, we'll still continue empowering the young people so that they can advocate their issues. It is easily recognized when themselves as young people talk about their issues than we. So us is just to empower them to be able to talk about their needs. So as a county, we have seen the gains.
As a young person, especially coming from Kuria, with the high prevalence of FGM, as young people, we are committed to campaigns of ending FGM, and working with several networks of CSOs, NAYA announced a call for application for advocates. We applied through a competitive process, and thank God we got selected, and we are here doing advocacy courtesy of NAYA now. Yeah.
Before PAMY project, I was a youth advocate. I can say I was a mentor at YAC. The YAC is a Youth Advisory Council for Health, Migori County. I was a mentor who was working at the community level. I can say as much I didn't know more about, I think I was not doing an advocacy work, I was doing a mentorship work. But when PAMY came on board, I was, the 15 of us, we were trained. After being trained, we were technically assisted on various advocacy skills like the budget advocacy, media advocacy, presentation skills. We were taken through the memorandum writing, the memo writing.
Harmful cultural practices and barriers accessing sexual reproductive health rights services such as distance to service points. Some of the main causes to these poor outcomes include lack of correct and comprehensive information on key sexual reproductive health rights issues including HIV and AIDS. Harmful cultural practices and barriers in accessing sexual reproductive health rights services such as distance to service points, lack of essential health commodities and services, lack of access to youth-friendly service, attitude towards service providers, lack of knowledge on where to access services, and retrogressive cultural and religious practices.
So the county in the beginning of 2018 came up with a multi-sectoral action plan. The reason why I'm saying multi-sectoral is because it's not a health issue alone. For us to meet the targets for the young people, for their well-being, we need other sectors. So we have other sectors that we came together, that is the Department of Education, the Child Protection, the Gender Department, the Police, the Office of the Commissioner, the Teacher Service Commission, among others. So we came together with the young people through the support of partners like NAYA and other partners. We came up with an action plan.
I'm the representative of young people at the Multi-Sectoral Action Plan Technical Working Group in Migori County. For me, I feel it's important for young people to be in the technical working groups. The reason as to why I'm saying so is that it's important for the young people to air out their views personally than sending a representative, maybe let's say a person older than them, because second-hand information never reaches the correct way. That's how they say. But also they are the ones who know their weaknesses, their challenges they're facing back at the community level. So that's it's very important for a young person to be represented at the technical working group personally.
The Participatory Advocacy Model for Youth PAMY project, implemented over the last 9 months by the Network for Adolescents and Youth of Africa, NAYA Kenya, came in handy with advocacy intervention targeting policymakers to address sexual reproductive health rights needs of young people aged between 10 to 24, especially young girls, persons living with disability, sexual minorities, and young people living with HIV.
I've got Cynthia Nyango, who is a student at that Kadika Girls. I've got Lennox Ochieng, who is at Onyalo Mixed secondary school, and these two advocates work with other students to tell them that positive mentorship on matters reproductive health, relationship while we are still learning, very important. I also have my daughter. She's one of the NAYA advocates called Asha and Alice. We move together and tell them that as you talk about sexual reproductive health, courtesy NAYA as a partner, talk about or empower youth with disabilities. See, our peer, in as much as disability, the feelings are intact, and they even feel much more. So it is important that we be as inclusive as possible. And this one, I salute NAYA because this is very inclusive program. That is why I'm a champion in NAYA.
I want really to appreciate NAYA. I want to appreciate NAYA, and when we are getting worried when we are told that time has come for them to phase out. We are praying that whoever was financing them should roll out the project and add us a few more years, because it is through NAYA that we've been having a series of meetings with them, and they've been incorporating and we've been inviting these youths from our wards, and we have time with them so that at least they are able to understand the budgeting processes.
NAYA have been involving the key influencers in the community, like the MCAs. Like we've had several forums where we have been having MCAs at the meeting. We've been having a one-on-one meetings with the MCAs. We have been capacity build on something like the SGBV. We were having a meeting involving both the youth advocates and the MCAs. So right now I can approach an MCA because I know we've been taken through like the process of approaching a key influencer, and how we are being told if you are given a 3-minute with an MCA, how can you interact with him or her, and she takes what you are concerned into consideration. So I'm comfortably can approach an MCA and convince him or her of, let's say, an issue that I've taken into him.
With a goal to enhance access to sexual reproductive health information and services for youth and contribute towards realization of their full potential in national development, NAYA developed and implemented various advocacy interventions in Migori County.
Over this period, we have been key in the implementation of Migori County multi-sectorial strategy for young people, and for the 2.5 years, although we've only implemented the project in 1 year, but we can authoritatively say that we contributed to the reduction of teenage pregnancy in the county by 16.3%. We also supported the county in terms of putting together an online monitoring and evaluation framework, which acted both as an accountability mechanism but also the reporting framework to be able to gauge the progress.
NAYA supported in development of the multi-sectorial linkage tool. This was a tool that was used in 3 sectors, that is the health sector, the children's sector, and the education sector. It was a tool that just linked from us as health when you document a pregnant adolescent, how best can we link them to the children's sector department so that they can do what they're supposed to be doing, and probably even link them to the school that they're supposed to be. And so with that tool, we were able to see that so many children at the age, children from the age of 10 to 19, who should be school-going children, are married and other pregnant, and they're not in any school, linked to any school. So we were able, in that collaboration of the 3 sectors, we were able to trace the children and bring them back to school. So that tool really helped us to reduce the teenage pregnancy, and not only even the teenage pregnancy, the school dropout rates in the county.
So we started implementation of the plan in July 2018. And so far, we even had our evaluation, which was recently launched, and we want to thank NAYA for the support of this. So what we've realized that teenage pregnancy so far has dropped from 37% to currently 21%. The HIV infection is also going down, and we're also ensuring there is adherence.
On behalf of the other young people who are voiceless, and we realize this has been a change over time. Again, we have done mentorship sessions to our young people, where we have developed and innovated an economic plan, and young people can now develop their own means. So as much as resources are limited, but young people can now sit back at the village, do their own economic activities such as fabric softening, preparing fabric softeners, putting up soaps. Our young people can now make soaps, and our young people can also now make bleaching agents that they sell outside to the community at a cheaper price, and they can also get something that they can help themselves with.
Since the PAMY project was launched in Migori County, multiple impact and success stories have been experienced. The project has established dialogue between 15 trained youth advocates and decision makers on adult sexual reproductive health right issues and policies, resulting in a systematic and sustained push for increased budgeting and policy implementation at national in Migori County levels.
Notably, in the last financial year, we realized there was a scrap in the allocation for SGBV, that is sexual gender-based violence. There was no allocation despite the high cases of SGBV in the county and also with the COVID-19. So that was one of the key issues that we highlighted in the budget. Also, the budget did not allocate for a resource or a rescue center for SGBV in the county. So that is one of the issues we highlighted as young people that really affects us in the county.
As a young person, we've developed memos concerning the budget, the budget estimates the fiscal strategy paper 2, and these ones we were able to present them to the MCAs concerning the budget allocations that were there. What we analyzed, if they're correct, which we found out there were a bit some complications, and we presented to them, and we found that they also didn't know about it. So as doing analyzing the budget and presenting it to them, it was kind of an addition to them, because they also didn't know.
The PAMY project has also directly and indirectly contributed to enhance partnerships with CSOs at the regional level for increased collaboration, information sharing and coordination in advocating for laws and policies that recognize the comprehensive health rights in the Constitution.
During the same period, we supported also the county in developing the gender-based violence policy that is aimed at creating a framework, but we've also seen 43 cases successfully prosecuted and concluded before the law of court. And so young people who are subjected to gender-based violence have been able to get justice.
I think PAMY project is one of the unique projects that has greatly capacity built the young people that we have been working with. Basically, as we speak now, we have young people who are able to interrogate county budgets to develop key asks to the policy makers. We have young people who are able to work with the county health management team just to try and review the negative indicators in relation to sexual reproductive health. We have young people who are economically empowered because we have also taken them through economic empowerment sessions. We have young people who are able to mentor themselves through the mentorship program that we have been providing to them. And now I can say that the 15 young people are all round young people in issues to do with advocacy, policy, budget analysis, and also engagement at the community level.
For instance, before PAMY came, I didn't know what budget entails, what county budget entails. But as per now, I know of physical strategic paper, the CIDPs, I know the budget estimate, and we've been taken through the budget analysis process, the technical assistance of budget analysis. We have analyzed several Migori County budget documents, and we've also rewritten a memorandum on some of the budget documents in Migori County.
The project saw continuous mentorship and coaching for the 15 young people trained in advocacy and budget analysis, with 6 bi-monthly project implementation review meetings taking place. This has resulted in the youth advocates not only presenting advocacy documents to the lawmakers, but also being published in national media outlets. By the end of the project, more than 50 articles on sexual reproductive health rights authored by the youth had been published in leading Kenyan dailies and online platforms.
And to achieve this, it involved building capacity of young people, linking them up with the policymakers at the county level, and also enhancing their skills on working with the media. And we've seen an immense publication of the thoughts and the lived realities of young people on with access to sexual and reproductive health and rights.
NAYA, through the PAMY project, has also supported adolescents and youth to participate in adolescent and youth technical working groups at the national and county levels. This has resulted in easy engagement of policymakers on the inclusion of budget line for adolescent and youth sexual reproductive health rights in 2020-2021 Migori County budget. The PAMY project, with no doubt, has opened doors to adolescents and youth on targeted forums with the Ministry of Health and decision makers, health and budget members of the county assemblies to lobby for a budget line on adolescents and youth sexual reproductive health rights.
Where NAYA helped, on issues policy, NAYA has, through the Participatory Advocacy Model, has supported different policies, and one of which was the policy on sexual gender-based violence that was launched on March 2021, and NAYA was a key actor in the development of the policy. PAMY was a key actor in the development of the policy. It was also a key actor in the production of the policy, the design, including the launch of the policy, and we are very proud that PAMY did this.
With the strengthened intersectoral coordination in the provision of adult youth sexual reproductive health services, PAMY has seen efficient, effective and well-sustained adolescent youth sexual reproductive health advocacy program in Migori County.
What has made us achieve most is the involvement of the young people. And I really want to appreciate the support of partners, especially NAYA, for the advocacy part of it. It's because we empower them for them to enable us reach the young people. So they're able to reach the young people with information and services, and also to reach even the top leadership for the county in terms of advocacy for their needs. And through that, we're able to see even the increase of budgetary allocation for the county.
In issues to do with young people, I want young people to be capacity built. You know, like previous, we were just there, we are representing young people, but we don't know. We are just there to be seen. But right now, we can stand up and speak for ourselves because we know our rights, we know the policies, we know what's taking place. You know, like in the past, we were talking about we young people, we are representing young people, but we didn't know even there's budget. The process of budgeting is taking place. But as per now, we know when there's public participation, we know when there is the ADP is out, where we know when the budget estimate is out, so we can go and do the participation. Like right now, as for me, I've attended 2 public participation for Suna East, and I think this is a great step because back then I didn't even know there was something called budget processing, even public participation in the first place. I didn't.
Commitment to them is that I'll be working hand in hand with them to ensure that they achieve or we achieve what we desire. So let them work as per they have been told, and I too, in any case they bring for me anything, I will assist them.
And if you remember the commitment of Kenya during the Women Deliver Conference, that by 2022 we need to get to 0 incidences of female genital mutilation, and therefore there is still more work to be done. We are still far from getting to that presidential decree, and we need therefore resources to be able to catalyze these gains that we have made over the last 1 year and also over the several years where we implemented other projects. We have built the capacity of young people, and therefore these young people needs to continuously be engaged so that they also can be able to make meaningful contribution into different processes that are going on at the county level, and also to be able to consolidate the gains more and more moving forward.
The work continues.